Hello, my name is Jason Suggett. The title of this presentation is Oscillating Positive Expiratory Pressure Devices and Airway Clearance Therapy in the Covid-19 Patient Care Pathway, a review of where there may be clinical value. I would like to disclose that I work for Trudell Medical International in a scientific capacity. The rationale for this study was that in the Covid-19 environment, it is unclear what role airway clearance devices such as OPEP have in therapy. Hence, it would be useful to assess the care pathway of a Covid-19 patient and review the evidence available to support or otherwise the use of OPEP devices. In terms of methodology, the assessment distinguished between two types of care pathway. Firstly, COVID patients with an existing respiratory condition associated with excess mucus production. And secondly, COVID patients with no underlying respiratory condition. Within each of these two types, there was further segregation into A, pre-infection, B, infection being managed at home or in a hospital, and C, recovery post-infection. The evidence-based positioning of OPEP therapy in each was evaluated. The evidence is clearer in patients with a pre-existing respiratory condition. So pre-infection, evidence does exist to support use of OPEP therapy to manage their chronic condition and therefore reduce likelihood of needing to seek medical attention with consequent risk of exposure to COVID. If COVID positive, OPEP therapy may be beneficial in order to manage the underlying respiratory condition. However, if this is done in a hospital setting, it would need to be undertaken in line with local hospital protocols to protect against airborne contamination. And for post-infection recovery, use of an OPEP device to manage excess mucus associated with a pre-existing respiratory condition may reduce risk of early re-entry to the hospital system. Situation is a little less clear for patients with no underlying chronic respiratory condition. So pre-infection, there's no proven clinical benefit, although there is some anecdotal evidence to support good lung hygiene. For treatment of COVID, OPEP therapy is not proven and the infection is not typically associated with excess mucus. However, a couple of references do advocate the use of OPEP as required in those instances where airway clearance therapy may be beneficial. And in post-infection recovery, there's limited evidence. For example, if patient has been ventilated or immobile for an extended period of time, there's some adjacent evidence associated with reduced post-operative complications when using OPEP. In conclusion, management of COVID-19 is a complex and not fully understood area. Patients with a pre-existing chronic respiratory condition exhibiting excess mucus will likely benefit from use of an appropriate OPEP device. The evidence is less clear for those patients without pre-existing respiratory conditions, with additional evidence beneficial to further support OPEP in treatment and post-infection rehabilitation.